Complementary and alternative medicine (CAM) has been practiced in India for thousands of years. The aim of this study was to determine the extent of use, perception and attitude of doctors and patients utilizing the same healthcare facility. Complementary and alternative medicine (CAM) has been defined as a group of diverse medical and healthcare systems, practices and products that are presently not considered to be a part of conventional medicine. CAM is being increasingly used by people all over the world. Many different areas make up the practice of complementary and alternative medicine (CAM). In addition, many parts of one field may overlap with the parts of another field. In the US, CAM is used by about 38% of adults and 12% of children. India is the birthplace of one of the oldest systems of medicines, Ayurveda, which had its origin around 2000 years back. Ayurveda, Yoga, Siddha and Unani and homeopathy are recognized in India as the Indian systems of medicines. Traditional alternative medicine. This field includes the more mainstream and accepted forms of therapy, such as acupuncture, homeopathy, and oriental practices. These therapies have been practiced for centuries worldwide. Body. Touch has been used in medicine since the early days of medical care. Healing by touch is based on the idea that illness or injury in one area of the body can affect all parts of the body. If, with manual manipulation, the other parts can be brought back to optimum health, the body can fully focus on healing at the site of injury or illness. Diet and herbs. Over the centuries, man has gone from a simple diet consisting of meats, fruits, vegetables, and grains, to a diet that often consists of foods rich in fats, oils, and complex carbohydrates. Nutritional excess and deficiency have become problems in today's society, both leading to certain chronic diseases. External energy. Some people believe external energies from objects or other sources directly affect a person's health. Mind. Even standard or conventional medicine recognizes the power of the connection between mind and body. Studies have found that people heal better if they have good emotional and mental health. Senses. Some people believe the senses, touch, sight, hearing, smell, and taste, can affect overall health. Examples of therapies incorporating this of the oldest systems of medicines. Ayurveda medicine, what is it and how does it work? Ayurveda is a form of medical practice that originated in India and focuses on maintaining a balance of all the forces at play within the body. When the body is balanced, it is healthy. Remarkably similar to modern medical practices, Ayurveda physicians focus on specific areas of the body. They educate patients on ways to maintain the balance of those areas, and work to rebuild the balance when illness occurs. The basic concept behind Ayurveda is the balance of the five elements: Akasha, space; Vayu, air; Tejas, fire; Apa, water; and Prithvi, earth. These five elements make up a whole of everything, including the world and living creatures. Each of the five elements is present within the human body. Earth, or Prithvi, represents the red blood cells, spleen, moral integrity and persistence. Water, or Apa, refers to anything within the body that has a liquid form. Fire, or Tejas, includes all of the operations of the body that remove impurities, that cause substances to change form, and that produce heat. Air, or Vayu, is present in the form of oxygen in the blood and also as the force that moves things through the body and mind. Space, or Akasha, does not form a physical presence in the body, but it is very much there. Space is the part of the mind and heart that accept love, emotion and impressions. Keeping each of these elements in balance is the key to Ayurveda medicine. Ayurveda principles of health are basic and simple. Many of them even seem common sense. These include the idea that proper nutrition aids in the balance of the elements within the body and thus promotes a healthy body that is able to heal itself. Add to this the inclusion of proper exercise, healthy relationships, adequate rest and mental health. The combination of all of these ensures a properly functioning body. The body has a tendency towards healing. This is a well-known fact, and is shown by the operation of even a poorly functioning immune system. Ayurveda medicine builds upon this concept, and looks at not only the disease itself, but the human that has the disease. Ayurveda practitioners understand that even in a person with a terrible disease and intense illness, there are aspects of health. Identifying what has gone wrong within the person's balance, or the doshic disturbance, is the key to curing the disease. Ayurveda medicine is an ancient practice that blends well with modern medical practices. Although only a few Western physicians practice Ayurveda, its principles seem to be a growing element of the modern health field. Tribhuvan Kirti Ras is an Ayurvedic medicine in tablet form, used in the treatment of acute and chronic fever, flu, running nose, sneezing, influenza, tonsillitis, pharyngitis, laryngitis, bronchitis. It is traditionally administered along with honey, fresh ginger juice, tulasi juice. Ayurveda and viral infections. All the diseases explained in Ayurveda can be well understood in Tridosha Siddhanta, where Tridosha affects the dosha, i.e. dotas and malas, causing different type of pathologies. These pathologies can be named as per the pain or other agonizing symptom or change in skin color and other affected organs. As the changes in lifestyle and environment are bound to happen, newer conditions are gaining to come up, hence they should be tackled as per the Tridosha theory explained in Ayurvedic classics. In Ayurvedic classics, Acharya Sushruta has mentioned about apasargic rogas, i.e. communicable and contagious diseases, in which it has been said that it can be transmitted by touch or breath, or through partaking of the same bed, and eating and drinking out of the same vessel with him, or through using the wearing apparel, unguents and garlands of flowers previously used by a person afflicted with this dreadful disease. If we see to the transmission of any type of viral diseases, the CDC, Center for Disease Control and Prevention, says that human viruses are most commonly spread between an infected person and others via the air, from viral particles from a cough or sneeze, close personal contact, touching or shaking hands, an object or surface with viral particles on it, then touching your mouth, nose or eyes before washing your hands, and rarely from fecal contamination. In Ayurveda there is a term called rotas, i.e. channel or path, which carry vital nutrients to various organs. The rotas also acts as one of the important factors in pathogenesis of diseases, as it is said that diseases are caused because of the obstruction in the rotas. The rotas related with the transportation and transfusion of prana-vayu, life-sustaining air, in the human body is coined as pranavaha rotas, respiratory system. This pranavaha rotas gets vitiated because of various reasons like raja, dust particles which are visible or may not be visible, containing viruses, duma, smoke containing air pollutants, shittasthana, cold environment. This raja when enters through mouth and nose develops disease like kasa, cough, hika, hiccups, schwaz, breathing problems like cough or throat irritation, pratishaya, running or stuffy nose, which are similar to viral infection. Ayurvedic management of viral diseases. Life starts with breath and ends with breathlessness. Life can be maintained by proper functioning of pranavaha rotas, which is in connection, mulsthana, with rudya, heart, and dashadaminis. This can be managed on the lines of pratishaya, kasa, schwaz and jwara. If symptoms of gastrointestinal tract like loss of appetite, indigestion etc. are found along with it, then it should also be treated along with it. Immunity of the patient should be increased with the help of rasayans. Rasayanas are the drugs which helps in delaying aging process, increases longevity, and intelligence and provide disease-resistant power to the individual. Best rasayan to prevent any virus can be giloy, tulsi, agastya rasayan, pipali rasayana. Drugs which can help in prevention can be Tribhuvan Kirti Ras, Lakshmi Vilas Ras, Mahalakshmi Vilas Ras, Chitrak Harataki, Aladi Vadi, Talisadi Churna, Siddhapaladi Churna, Kantakari Grita, Vesa Grita, Schwaz Kas Chintamani Ras. Single herbs which can be used effectively in these type of cases can be Kantakari, Pushkarmul, Harak tea, Pipali, Tulsi, Sati, Brihati, Amalaka, Elaichi. Dopan Karma and Ayurvedic treatment can be used to prevent the viral attack. Dupana Karma is the use of medicated fumes by burning of dried plant and animal parts. We can consider it as a yagya or haven at the place where we are living. It includes fumigation for creating aseptic environment for the healthy beings so that no infectious disease can develop, especially wards fumigation and mass areas. Acharya Kashyap has explained Arishta Dup which destroys all diseases. You can use cow dung, gobar, for burning the fire and add cow ghee along with nimb patra, neem fruit, neem bark to make smoke. Let this smoke circulate the place where you are living to prevent the virus entry. Prevention is better than cure. So increase your immunity to prevent the virus entry inside you. Our immune system is at the center of strongest defense against all illness.